Hey everyone, welcome to the Clinical Corner. Today we're going to be talking about tips for culturally competent care. Nurses care for everyone, including those from different cultures, religions, and belief systems different than our own. So here with me, I brought my teammate and clinical RN Betsy Martin, who's going to give some insight on this topic. So Betsy, how do we put our personal beliefs aside and provide the quality care everyone deserves?
Right. As nurses, we take care of everybody. So we're taking care of people who have different backgrounds than us, different religious beliefs, different attitudes, values, things like that. So one of the first things to do is to really do a self-assessment. So step back, kind of take a look at what are your own beliefs and your own values. How were you brought up? When you have more awareness of yourself, then you're able to discover areas that you might be judgmental or might have bias towards others.
And what advice would you give to other nurses that don't know much about other cultures?
So really get out there and educate yourself, especially if you have any particular ethnicities or groups that might be prominent in your area. For example, when I worked in Indiana, there's a large Amish population, and just by asking around and getting more information, I was able to know that modesty was really important in their culture. So I was able to implement that in my care for them, and that made them more comfortable and made them have more trust in our care.
And it's almost impossible to know every single thing about every single culture. What advice would you give to kind of learn about the other cultures?
Right, you're not gonna know everything about everybody, and there's even differences within the cultures too. So one of the best things to do is just ask questions. Just ask them, how are they feeling about their treatment? Do they have any reservations about anything we're suggesting to them? Do they have any fears? Just try to discover anything that could be a barrier to them being compliant with the healthcare we're trying to give them.
Okay, and how should nurses adapt and accommodate?
Right, so again, asking those questions to find out what their needs are. And a lot of times their needs are pretty simple, and you can just make a few adjustments that make a really huge difference for them. For example, you might have a female patient who only wants female caregivers. So you would make that accommodation for that person. And there's a lot of little things that you can do once you know more about them that you can make them feel more comfortable.
Thanks everyone for tuning in. If you have any additional questions or comments, make sure to comment below or reach out to us today. Thanks for watching.